In this section, we're going to talk about nerve blocks, and we're also going to touch on pain management for chronic oral surgery cases as well. And when we're talking about doing nerve blocks, what we're doing is not only providing the regional anesthesia so that we can have some post-operative analgesia, we're also decreasing the demand that the patient needs to keep it under anesthesia. In other words, we're decreasing the MAC of the inhalant anesthetic such that we can keep these patients much lighter because they don't feel what we're doing. And we like to keep our patients at a level that's consistent with still having a palpebral reflex. Our patients in general can still swallow. When we turn them to do the other side, after we've completed a quadrant extraction, they start to ambulate. So we like to keep our patients really light. And what that does, it maximizes cardiac output, maximizes blood pressure, and not only makes it such that the patient's much safer under that lighter plane of anesthesia, but they wake up extremely quickly. And all of those physiologic parameters are maximized so that they're also kept warmer, which is extremely important with these little bitty patients that we traditionally see for periodontal pathology, whose surface area to body ratio is just not real consistent with maintenance of normothermia under general anesthesia, especially deep general anesthesia. And using nerve blocks gives us that extra advantage and makes it such that many procedures that would have to be terminated due to hypothermia in these smaller patients can progress to completion, whereas if we did not keep the patient at a light plane of anesthetic, that could not happen very, very readily. So extremely important, not only from the analgesic standpoint, but also from the patient safety standpoint. So when we're using nerve blocks, we're generally talking about bupivacaine. We use 0.5% bupivacaine, which is Marcaine, and our maximum per patient dose is 2 milligrams per kilogram of bupivacaine. So when we're talking about the whole patient, we may have anywhere from 1 to 4 quadrants that we're blocking. So we have to look at the patient size to determine a volume that we can infuse into each site that we're working on. So that volume per site can be anywhere from 0.1 to 0.3 milliliters for patients that are 6 kilograms or less. And these are numbers that have been established by our practice over the years. They've been published, and they're totally subjective, but they are extremely effective, and I think you'll find that these are adequate in almost every, if not every case. You have a patient that's 6 to 25 kilograms, 0.3 to 0.6 milliliters per site. Again, making sure that you are, especially in the small patient that we just mentioned, in that category where your total body dose is less than 2 milligrams per kilogram of bupivacaine. And that's a very safe dose of bupivacaine. We're giving that extravascular, so it's in the tissue, it's not in the vessel, extremely safe. Little larger patient, 26 to 40 kilograms, we use 0.8 to 1.2 mLs or so. And then if we've got a larger patient, we might go up to 1.6 mLs, so 1.4 to 1.6 mLs. Now, when we administer these local anesthetics, they sting.